Hello everyone. In today's video, we're going to explain 10 possible warning signs of diabetes, why they can happen, and which tests doctors commonly use to check blood sugar. But remember, symptoms alone cannot diagnose diabetes. The only way to know is through appropriate medical testing. Let's begin. Number 1. Frequent urination. One common symptom of diabetes is urinating more often than usual. When blood glucose becomes too high, the kidneys may remove some of that extra glucose through urine. Water follows the glucose, which can increase urine production. This may lead to frequent trips to the bathroom and, for some people, increased urination during the night. However, frequent urination can have many other causes, so it should not automatically be assumed to be diabetes. Number 2. Excessive thirst. If you're urinating more frequently, you may also become unusually thirsty. Your body is trying to replace the fluid that is being lost. You may notice that you're drinking much more water than usual and still feeling thirsty. Persistent excessive thirst deserves medical attention, especially when it occurs together with other symptoms. Number 3. Increased hunger. Another possible warning sign is increased hunger. When blood glucose cannot be used properly by the body's cells, the body may not get the energy it needs from glucose efficiently. As a result, some people may feel unusually hungry even after eating. Again, increased appetite has many possible causes, so testing is important. Number 4. Unexplained weight loss. Some people with diabetes may lose weight without intentionally trying to. When the body cannot effectively use glucose for energy, it may begin using stored fat and muscle for energy. This can contribute to unexpected weight loss. If you are losing weight without trying, especially if the change continues, talk to a healthcare professional. Number 5. Constant tiredness. Feeling unusually tired or weak can also occur with diabetes. When glucose is not being used effectively by the body's cells, you may feel that you have less energy. But fatigue is extremely common and can result from many conditions, including poor sleep, anemia, infections, stress, and other health problems. Persistent, unexplained fatigue should therefore be evaluated rather than self-diagnosed. Number 6. Blurred vision. High blood glucose can sometimes affect the fluid balance in the eye and cause temporary blurred vision. Some people notice that their vision becomes less clear, but changes in vision should never simply be blamed on diabetes. If you experience new or persistent vision changes, speak with a healthcare professional or eye care professional. Number 7. Slow healing wounds. Another possible sign is that cuts or wounds seem to heal more slowly than expected. Diabetes can affect blood vessels, nerves, and the body's ability to respond to infection, particularly when blood glucose remains high over time. A wound that is not healing properly should be checked by a healthcare professional rather than treated at home based only on information from the internet. Number 8. Frequent infections. People with diabetes may be more likely to experience certain infections. Some people may notice repeated skin infections, urinary infections, or other infections. However, frequent infections can have many causes. If infections keep coming back, it is worth discussing the pattern with a healthcare professional. Number 9. Numbness or tingling. High blood glucose over a long period can damage nerves. This condition is called diabetic neuropathy. It can cause symptoms such as numbness, burning, or tingling, particularly in the feet and hands. These symptoms should be evaluated because nerve symptoms can also occur for many other reasons. Number 10. Dry or itchy skin. Some people with diabetes may experience dry or itchy skin. This can be related to dehydration, changes in circulation, skin problems, or other factors. But itchy or dry skin is very common and does not mean that someone has diabetes. If it is persistent or accompanied by other symptoms, talk to a healthcare professional. How do you know if you have diabetes? This is one of the most important parts of today's video. You should not diagnose diabetes based only on symptoms. Doctors commonly use blood glucose testing and A1C testing to assess blood sugar. The A1C test gives an estimate of average blood glucose over approximately the previous 2 to 3 months. Depending on the situation, a healthcare professional may also recommend a fasting blood glucose test or an oral glucose tolerance test. Your doctor will decide which tests are appropriate for you.